Good morning. Thank you, Beth, Ray, and Dr. Christian for this opportunity. And I'm here today to present to you guys radiation safety in the cath lab. These are my disclosures. So before we begin, I know it's a little bit of a long session. I just want to get a poll of the audience. We use radiation in the cath lab, and I just wanted to see who you guys think gets more radiation. Someone that works in a power plant or someone that works in the cath lab. So for those that think that someone that works in a power plant gets more radiation, could you just raise your hand? And the cath lab? Okay, you guys are pretty on point. So I want to go over the basic principles of radiation. How do we protect ourselves? Because it's so dangerous, the radiation effects. And these variables that we can do in the cath lab to reduce radiation. So what is ionizing radiation? It's radiation that carries enough energy to actually remove an electron from an atom molecule. And these come in the forms of X-ray machines, which we see in the hospital, cosmic particles from outer space. This is why people traveling in planes have radiation exposure. And also radioactive elements that are in the ground. X-ray is a type of ionizing radiation that has the penetrating power to make detailed images of bones and soft tissues within the body. That's one of the reasons why we use it for medical imaging. And in the cath lab, when we're doing procedures, we use fluoroscopy, which is live video X-rays. That's how we're able to perform minimally invasive procedures. So when we talk about the risks associated with radiation, there are two types, stochastic and deterministic. Stochastic risks are those that we employees in the cath lab and working around radiation are more concerned about, that there's a linear no threshold hypothesis that there really is no safe dose that exists and it accumulates along your exposure in the cath lab with this occupational risks. These things that can cause cancer and hereditary defects. The other risks that we're more concerned about for patients are deterministic, and they basically occur from one big bulk dose of radiation. And generally we see these changes as skin changes. Patients can have cataract, sterility, and even some radiation sickness in higher doses. So the risks associated to the cath lab team in my poll earlier, as you see that cath lab staff, actually the physicians get almost double, more than double actually, the amount of radiation than a nuclear power plant worker. So these are one of the things that's really important for us as staff to make sure that we can support cases appropriately, use less dose, use less radiation, and we can protect ourselves, protect our patients. One of the other more stunning things is that interventionalists are, we don't know if it's incidental or if it's caused directly by radiation, but left-sided brain cancer is one of the striking things that with radiation in the cath lab. So we monitor our radiation dose by our radiation safety department in all your hospitals, where we wear our dosimetry badges that are monitored monthly. And if your dose gets too high, they come and lecture you and tell you that your dose is too high and ways you can protect yourself, and they recommend staying away from radiation for some point. For the patients, the nurses and technicians, when we're seeing patients, one of the things that we're concerned about for their safety is skin injuries. So this is a particular case, injury on a patient's back where they got, believe more than 15 grays of radiation. Generally, the threshold of skin injury occurs above 2 gray, but over 15 gray becomes more profound. In the cath lab, we all know that the radiation source is the C-arm or the X-ray tube. And for patients, that is their main source of radiation. For the staff, the physicians, the interventionalists, the nurses, the techs, the patient actually becomes the source of radiation because of scatter radiation. And as you can see, the side that the X-ray tube is, which is on the bottom of the C-arm, is the main source of radiation. So the radiation source begins here at the X-ray tube, goes through the patient, and then is captured in the image intensifier. So as the X-rays go through the patient, the radiation dose for the cath lab staff will scatter as it hits bone and other soft tissue, and that's what our biggest concern. How do we monitor that in the cath lab? We watch the fluoroscopy time, air karma, and dose area product. So we begin to get worried about substantial radiation doses in patients that get more than 5 gray, and at Mount Sinai we have a protocol where we educate these patients that get more than 5 gray of radiation. And as we know, as the higher the dose increases, the risk of severe skin injury occurs. So how do we protect ourselves and other patients from the harmful effects of radiation? There's three basic fundamentals of radiation protection: justification, does this study need to be done? Optimization, make sure that the settings and what we're doing is ALARA, which is as low as reasonably achievable. And then also the dose limits, although it may not also be fair to have a dose limit, because for those patients that have a complex procedure, it also may not be appropriate to consider a dose limit. So three basic principles, again, to protect ourselves in the cath lab: it's shielding, time, and distance, creating a barrier between you and the source of the radiation, whether it's the X-ray tube or the patient. Time, making sure that we can work efficiently so that we can keep a reduced dose, and also distancing yourself. Distancing is one of the most important things, and I'll show you in a next slide. Shields, lead aprons, they stop about 95% of scatter radiation. Thyroid collars, wraparound aprons, and eyeglasses all help to protect the exposure to the operators and the staff. And also now they have disposable radiation protection pads, this RAD pad, which does help cut down a significant amount of radiation scatter as for the cath lab step, since we know that the patient is the source of the radiation. To minimize fluoroscopy time, one of the most important things, especially for the nurses and techs here, is working efficiently, anticipating the next step. The longer we struggle, the longer we try before you get the next equipment, the more fluoroscopy time, the more dose. So teamwork, I think, is very important to maintain ALARA. With distance, the inverse square law for radiation is very true. For every time you double your distance from the source, the radiation is only about 1/4 less. So it's a 75% reduction of radiation intensity by distancing yourself. And for the procedural staff, if you don't need to be in the room, there's no reason you should be there. Just avoid radiation, as a patient is the source of radiation. For our operators, especially in the endovascular space, that our hands are very close to the image detector, and trying to distance themselves is very important. So techniques that we could do to lower radiation dose, one of the most important things is that our table is high up and the image intensifier is very close to the patient. This overall lowers the overall delivered dose, and angulation and magnification also substantially increase radiation dose. So by as much as possible, working in AP projections or working in low magnification versus increasing the magnification will increase the dose. So these are things that we consider while we're doing these procedures. Culmination is basically a lead shutter that is located above the X-ray tube. And what it does is it reduces the amount of radiation that comes out. And because the radiation dose is less broad, it also reduces scatter, which improves the signal to noise ratio. That's why we're able to get better images with using less radiation. In the endovascular space and doing endovascular interventions and angiography, we all know that digital subtraction angiography is the gold standard. And that's how we're able to visualize the arteries very well. DSA works by taking an acquisition of the artery of the leg, and then the computer works by digitally subtracting out the bone, so you can just focus on the artery. This methodology is very similar to Cine, uses more radiation, but in the hands of trained, experienced interventionalists, it may improve the efficiency in doing procedures. So some 10 takeaway points from the International Atomic Energy Agency. For radiation is internationally regulated by so many different committees. There's 10 pearls that I mentioned before. I'll just summarize quickly. So number one is to maximize the distance between the X-ray tube and patient. So lifting the table as high as possible. Keeping the image receptor as low as possible. The eye close to the patient as well helps reduce scatter and radiation dose. Minimizing fluoroscopy time, having the team efficiently working together to improve patient outcome. Another thing that we can do is to use pulse fluoroscopy and lower the frame rate. And to protect our patients, number 5, protecting our patients, we shouldn't expose the same area of the skin, because repeated exposure to the same area of the skin can cause skin injury. Another thing to consider, that patients with larger body habitus as well requires larger dose to penetrate and to make an appropriate image. Oblique objections increases the estimated skin dose, as well as the use of magnification. Most importantly, it's like to minimize the number of runs and Cine runs and usage in the cath lab. So by using FluoroSave versus Cine to document our interventions, and use of culminations. So in summary, I think it's very important to create a culture of radiation awareness. As nurses and techs, you may not be at the table, but you do have a big impact towards the overall outcome of the procedure just by anticipating what they need, being familiar with the procedure and understanding what the interventionalist needs and what their next steps will be. Instead of letting the operator struggle and struggle and struggle, you already know you already have the next equipment there. That, believe it or not, changes their mind quickly and lowers their threshold to trying another modality. The other thing that as a team, you guys are monitoring. The interventionalists are very focused on what they're doing, and if they see that the image intensifier is up, we can just remind them, hey, lower the image intensifier. And as well as the fluoroscopy settings. If you notice that this is a beautiful HD image, you're just like, you would know that, hey, you're on 30 frames and there's no reason that to be giving this much exposure. So this awareness is very important in addition to monitoring the overall dose will overall improve patient outcomes, our own safety in the cath lab, and just reduce the risks for both the patients and staff. Thank you.